Trendsetters.
Welcome to the Elevating Aesthetics Podcast. I'm Brittany Perez.
And I'm Megan Diaz.
And today we're all the way in Houston with our friend Cheryl.
So glad you're here. It was such a surprise. How cool is this?
Cheryl wears many hats. She is a national speaker. She owns multiple practices. She has a training academy. Tell us a little bit about yourself.
I am in Houston, Texas. I'm so glad you jumped on a quick flight over here. I do own Pure Medical Aesthetics. I have an aesthetic practice for 6 years. About 4 years ago, we opened Aesthetic Nation Institute, and that is also our training facility. It's accredited upstairs. We are actually in a training program right now, so I slipped away for lunch.
With Texas regulations, I know it's so much different than our regulations in Florida. How do you approach safety and set standards as an injector, but also as a trainer?
We just talked about this. I find that it's something so vital to the aesthetic industry. The word safety.
Yes.
Patient safety is fundamental, it's key. And I think as educators, as providers, it's something that we have to be committed to. In Texas, with the laws being different than the US, anybody can inject here. Pam the barista to Linda the telemarketer, anybody is injecting on their lunch break. And it is setting a standard. As a licensed medical practitioner, it's something that I walk that line for. Ethically, morally, I believe that this is medicine. We're practicing medicine, but the reality is that we have unlicensed medical providers injecting. So as educators, really it comes down to, do we ensure that they have the information, the education that is standard evidence-based to practice safely? And that's where I walk that line.
Yes. Because
as an educator, I want them to be safe, regardless if they're licensed or not. In nursing school, we didn't learn to inject. It was a hands-on, on-the-job training. But we did have that critical thinking, the knowledge how to handle emergencies, how to handle crisis, which we know the worst case scenario, vascular occlusion. It's a medical emergency.
Yes.
Most practitioners aren't prepared to handle that. So it really comes down to who has access and the right to that knowledge. So I've struggled with it through my training academy, and I think that I'm at a place now that I think education should be accessible to all. It should be a standardized level of education to ensure the public's safe.
And maybe if the person is a non-licensed provider, they have to take even extra training. Like maybe there's some type of step that we could create where they have to have like anatomy knowledge, and then they can take their entry level training. If Texas maybe could pass something like that. What are you doing to kind of help lobby for that, or what could other people do to help lobby?
There's a couple initiatives that I've started that's really passionate and close to my heart. The first one is aligning with Dr. David Sadat. We have a cadaver course. It's a roadshow coming up. We had Raise in March. We had Cadaver in March as well. I'm trying to remove those barriers and make it more accessible to all injectors, regardless of license. We have a roadshow in October. We're doing Fort Worth, Dallas, and Houston, making it financially accessible as well, depending on the level that they want. It's a full day complication management course and cadaver. So we're trying to ensure that all providers have access to this level of knowledge, just basic knowledge to be safe.
Yes.
That's the first initiative. And then additionally, we're trying to establish, we're about 3 months into a network. It's called a 911 network.
Okay.
It's a national initiative to ensure if I have a practitioner that is in Pensacola, they can reach out to Mila and say, I have a medical emergency.
Yes.
Will you be a resource? I want to have a site in multiple states for this to ensure that there is a resource. Oftentimes they can't recognize it. And when they do, who are they going to turn to? They're shamed, they're shunned from the aesthetic community because they're unlicensed. But is that the industry we want to propel forward?
Right.
Do we want to ensure that they have access to providers like us that are licensed that can help direct and guide them to improve patient outcomes? So those are two initiatives that are really close to my heart that we're working on.
I love both of those. I have become kind of like an access point in Pensacola for vascular occlusions because I have an ultrasound, and that helps tremendously in having protocols in place. So through your cadaver labs, are you guys, once you teach them the protocols, do you kind of have like a printed protocol for them to go home with as well?
Absolutely. I think the resources and accessibility to those resources.
Yes.
MERT's recently released their evidence base by Dr. Yanni van Lohan that had the steps on managing a VO, a vascular occlusion, and both for CAHA and HA. And I posted that on my Instagram, and I think we got over, I think it was 15,000 likes this last time I checked. That's the response. People want that. They need that.
Yes, it's
we
necessary.
have one printed in our clinic in the cabinet, and you wouldn't believe the people when we open it. They're like, "Oh, we need to put that in our clinic because it's so important."
It is. And people that have been injecting for 5-10 years that have never like even gone through a VO mock, protocol. So it's definitely needed. I agree.
I love that you are prioritizing safety, whether they're licensed or not, just to make sure that the patients here are safe and that they're taken care of. And honestly, some of the newer providers, even if they're not licensed, they may not know the anatomy, and that is an eye-opener for them to come to your class and they're like, wait, maybe I don't know as much as I thought I did, and then they can kind of learn more and kind of get down to what they need to know.
Yes.
The less we know, the less fear we have. And as we train, I don't know if you see this
I
in
agree.
your training facility, people who don't know anatomy, they're fearless until they know anatomy and take a cadaver lab.
And then they realize what's under there.
Exactly.
What could happen.
Right.
And those anatomical variations.
And that's even me whenever I first started injecting, because I did inject with a plastic surgeon who's incredible, but because they actually cut vessels, they don't really see that it can cause damage, right? Because they're like, well, if I cut it, you can't really occlude it. So there was some misunderstanding. So I would go straight in the middle of the temple. I would not aspirate anywhere. And I didn't really understand how to reverse. We didn't even have Hylenex in the clinic. So I do feel like it's very valuable. Even, yes, we're talking about non-licensed, but there's plenty of licensed professionals that don't have that training also. And so that's really important. One of your favorite things and something that you're so amazing at is regenerative medicine. And that is really the path that we're kind of all taking in this space right now. So what do you feel like is one of the most valuable regenerative treatments in your practice?
I love combination. So I am a big proponent for oral therapy.
Yes.
And I love combination with CAHA, calcium hydroxylapatite radius. I think treating multiple layers of the skin, so we age on 5 layers, let's exclude the temples, but those 5 layers, I think we have to address them.
Yes.
And knowing when to do the treatments, what we're stimulating. Are we stimulating fibroblasts? And this is a very interesting topic because now I'm having the conversation about hormones.
Yes.
GLPs have impacted the way we have neocollagenesis.
Yep, we were talking about that today.
Hormones are impacting the way women can produce collagen and elastin and regenerate.
Yes.
So we're having this extensive functional conversation to ensure that we can meet the patient's expectations. I can tell them you're going to get a wonderful outcome, but if they're not hormonally optimized, they're going to have subclinical results. So I think having those conversations are vital to patient satisfaction and retention.
Yes, absolutely. And, we've kind of been having conversations about GLPs and the effect on the ability of your body to stimulate fibroblasts. Like if we are if we're waiting to start biostimulators once they're already on GLPs, are they getting the same effect?
And I love priming, this idea of priming the skin and getting them to a position that they already have that fibroblast activity, because we know as we age, fibroblasts become senescent, they go to sleep.
Yes.
So priming the skin and ensuring that they're ready for that regenerative neocollagenesis.
I love that.
What advice would you give to a newer injector?
I love this. Somebody asked me this recently. I was on another podcast, and the advice that I would give is don't let other people define you, determine your path. Know who you are, establish your mission, surround yourself with a tribe that wants the best for you. Now, my entry into aesthetics was not a great one. I call it the ugly industry, and it wasn't welcoming. I spoke on stage with some really great people I looked up with, KOLs, and I was ostracized. And I've talked on stage about this.
I did not know that.
It's true. And they were not warm, they were alienating. And on that stage, that national stage, it was a huge conference. There were about 2,000 people in front of me. I made that moment a defining moment in the trajectory of my career, and I said, I will never make anybody feel that way. I will be a welcoming place for people to come get knowledge. I will empower others. I will ensure that they're successful. So don't let other people define you, determine your path. If it is your mission, your vibe attracts your tribe.
Yes.
So surround yourself with people, like-minded people who want the best for you, and let go of the ones that don't.
Yes, being a mentor is so important. We actually spoke about this on one of our previous podcasts. I entered into the industry to Brittany.
One of
That's
the best
all I
mentors.
know. One of the best. And so
Absolutely.
I definitely feel for newer providers that don't have someone to lean on, because there's so many times during the day, even after 2 years, that I'm like, hey, what do you think about this? I run ideas and bounce things off of her constantly. So to not have that, that's scary. So I'm really glad that you are a mentor to others.
And as a leader, and you're a leader in this industry, I think it's our responsibility to empower others,
Yes.
to guide them, because a great reflection of how successful I am is somebody superseding me. If I can instill knowledge and they go take that and they reach over what I expected for them and they are successful, then I've done a wonderful job as a leader and as a mentor. So I think that that's a defining moment
Yes.
in leaders, really their journey, to say, okay, I did something good.
I was just talking to Haley yesterday about people kind of coming through the business, and ideally as a business owner, you want to train people to stay. But ultimately, because I've had some people that I have poured into, whether it's time, financially, in multiple different ways, and they've taken a break from the practice for whatever reason, but I will never regret pouring into someone. I will never regret mentoring someone, because that is where my passion lies. And so I hope that everyone stays at Mila forever, but we just know that it's life. And sometimes we have different seasons of life that we get pulled away, but I agree with you. If we are able to make someone better than us, like, we've done our job.
We have, and you're a pedestal for others. Other people will use you to springboard, and that's okay, because that's your divine mission.
Yes.
I think we all have a calling, and oftentimes as leaders, as mentors, we're meant to just serve a pedestal for others to rise to their true calling.
Yes, absolutely.
I've really enjoyed this. It was so nice to meet you.
And so great to see you.
I know,
I don't
I know.
see you enough. I'll have to come back over to Houston.
I'm going to
Maybe
come to that cadaver.
you should. Let's.
I'm going to come.
Yeah,
I'm
we'll
gonna
set
fly
that
to
up.
Houston whenever you get the date.
Okay,
I love
perfect.
that. I
We'll
love
set that
sit-down.
up. So how can they follow you on social media?
Sure. So I have 2 social media handles. I have The Real Injector, and then I also have Aesthetic Nation Institute. So they can follow me either one.
Awesome, and we will put it down in the bio as well. Thank you so much.
Thank you. This was so fun.
great to see you.
Absolutely.
It was amazing.
Awesome.